Somalia's health ministry has issued new restrictions and guidelines as it is recognized a new wave of the coronavirus is affecting the country. International travelers are affected, with some nationalities requiring self-quarantine on arrival. Other restrictions affect Somali citizens and visiting foreigners, including those working for the African Union and the United Nations. A new nighttime curfew will be imposed, with individual states setting the timings. Mask wearing and social distancing is compulsory in restaurants, mosques, markets, hotels, and events. Public gatherings are to be postponed for now. Some criticism is bound to follow this restriction, as some may want to demonstrate against the current political crisis. Only meetings of vital importance are allowed. One would infer that elections are of vital importance. Burials are to have a limited number in attendance. Public transport will continue, but with mask wearing and social distancing. Offices and private businesses must offer areas for hand washing and sanitizing, as well as enforce mask wearing and social distancing. Travelers must come with a certificate showing a negative test for COVID-19 within the last 72 hours. Foreigners without a valid certificate will be sent out on the next plane. Somalis in the same situation will have to quarantine for 14 days. Foreigners, even with certificates from the following countries, will have to self-quarantine for 14 days: Bangladesh, Brazil, India, Iran, Mexico, Nepal, Saudi Arabia, South Africa, Sri Lanka, Uganda, United Arab Emirates. All AMISOM and UN forces rotating in have to follow a strict regimen implemented by those organizations. Traveling children under 12 years old will not have to produce a negative test certificate. Government employees must receive vaccinations. Private sector businesses are also required to provide vaccinations for their staff. Both government and private offices should encourage employees to work from home when possible. ADN TV will continue to report on the Somali government's efforts to protect its citizens against the COVID-19 virus.